So how does one think about opening this lockdown in a way, medically, so that you minimize this type of uncertainty, so you don't have an accident with the second lockdown? What are the type of things medically you need to think about?
So first thing, I think it's really important, and I've been saying this here, and I think it's really important for everybody to communicate, is that this is a 12 to 18 month problem. We are, no matter what we do, we're not going to be out of the woods. We're not going to be through this problem by July or by November. This is going to be with us till 2021. And if everything goes very, very well and we have a vaccine and it's widely available, then sometime in 2021, life can begin to go back to normal. The reason it's important to communicate that is people need to understand the time frame and need to understand that lives.
Because if
it would help a lot.
It would help, because if you could test at scale, you could test everybody, then you're much safer.
Yeah, and and obviously testing everybody, or depending on how big a population, is difficult. There are strategies that you can use to augment and do, there's pool testing. There's all sorts of things you can do to test large numbers of people with more limited kits. I've also felt that, India has many advantages. And one of them is as a very, very advanced, very vibrant, technology and biotechnology industry, with a lot of people who have a lot of capacity and capability. And so, when people have brought up testing and India's testing capacity, my sense is, what I say is, look, I'm not an expert on the exact specifics of which company in India can do what, but everything I know about India and everything I know about testing, on which I do know something, makes me think I am not convinced that India could not do much more testing than it does right now. I don't know why it couldn't. So, India's obviously been moving forward. They've been doing 80, 100,000 tests a day now. That's good. That's real progress from where things were. But I don't know what prevents us from being able to do many times that. And if we can get up to that level of capacity, then yes, we can test migrant workers before they get on trains.
I've asked some bureaucrats why sort of lower testing numbers, and their point is that if you push the testing numbers too high, you frighten the people much more, and you build up a much more frightening narrative. So that is, unofficially, that's sort of what they say. I think it's much more important to fight the disease and, push as hard as you can on the testing. But